और उनका पति था, हमसे बोलते थे शादी कर लो, हमने बोला कि नहीं शादी करनी। तो उन्होंने, मैं घर में रात को अकेली थी, तो ऐसे ही गेट खटकाया उन्होंने, तो तुरंत ही मेरी आंखों में डाल दिया केमिकल, तुरंत ही नज़र बंद हो गई मेरी। तो वो अब तो जेल में है। और मैंने बहुत ही जगह इलाज करवाया, कि बहुत ही जगह मैंने बहुत पैसा भी खर्च किया, लेकिन कहीं से मेरा इलाज नहीं हुआ और रोशनी नहीं मिली मेरे को। तो मैंने चंडीगढ़ में भी 5 ऑपरेशन करवाए थे, तब भी मेरे को रोशनी नहीं मिली। लेकिन इधर मैं हैदराबाद में दूसरी बार आई हूँ और मेरे को दूसरी बार आने से रोशनी मिल गई है, कि आज मैं देख सकती हूँ सबको। डॉक्टर सागवान तो बहुत भगवान का ही रूप है। डॉक्टर टॉर्चनी ने मेरी पलक बनाई और डॉक्टर सागवान ने मेरा ऑपरेशन किया। आज मैं 11 महीने के बाद दुनिया देख रही हूँ। ये हमने रेड सी डाली। जब मैं 10 महीने से कुछ दिखाई नहीं दिया, तो एकदम मिट्टी थी मेरी ज़िंदगी। आज मेरे को जो थोड़ी जीवन मिल गया, तो आज मैं ज़िंदगी व्यतीत कर सकती हूँ अपनी, और मैं अपने के लिए चलने फिरने के लायक हो गई हूँ। अपनी लाइफ जी सकती हूँ, एक आंख से जी सकती हूँ।
As Sheikh Hasina slept outside her house one still summer night, a vengeful neighbor crept up and splashed acid on her, corroding her face and damaging her eyes. Her eyelids and a significant part of the surface of her eyes were destroyed, including the regenerative cells that line the inner part of the eye at the limbus. At the time, clinicians at the L.V. Prasad Eye Institute, supported by an active scientific research program, were taking limbal stem cells from healthy eyes, culturing them in the lab on human amniotic membrane, and transplanting them onto damaged eyes. These eyes could then undergo a corneal transplantation when a donor cornea became available. Such a transplant was performed on Sheikh Hasina's damaged eye, and after a period of follow-up care, she was able to see with one eye that had not been completely eaten away by the acid.
When somebody goes blind, he does not simply loses the eyesight. He loses much more than that. He loses the hope to live, hope to be independent, and things that cannot contribute to the society. But my view is that those patients can be rehabilitated very efficiently with the use of stem cells. In the acute phase, variety of new treatments are available. So there is a good hope that these patients can do very well in the long run. When the acid touches your eye, accidentally or intentionally, or it's an assault, what happens is the tissue becomes coagulated, it curdles, it becomes thick, it becomes opaque, and the acid injury causes the rise in eye pressure immediately. If there is a doctor, any kind of doctor nearby, what they should do is irrigate or wash the eye with a lot of water and clean it and make sure that acid is removed from the eye as soon as possible. After that, the first aid would include giving topical steroids, antibiotics, vitamin C, pressure lowering drugs, and if the patient can reach an eye doctor, there is a very good treatment called the amniotic membrane transplantation in the acute phase, and if that is done, it can save the patient's eye and it can change the course of the treatment for the patient forever. If you do the amniotic membrane transplantation in the acute phase, the chance that the eye will recover its own stem cells is very high, because it is derived from the placenta on which the fetus, growing fetus, derives its nutrition. So it's full of nutrients and it heals the eye much faster and reduces the impact of the acid burn on the eye. For those patients who did not have access to a good treatment, eye treatment in the acute phase, that in early phase, and have reached a stage that they lose their eye but not completely, meaning their eyes can still see the light perception, what we call. So in those patients, maybe we may have to do a stem cell transplant, we may have to do a skin transplant depending on the burns of the lid, and with these treatment there is a good hope that they can see again, and subsequently they can have an eye transplant, and or there is something new what we have started doing for last 5 years called the artificial cornea or a synthetic cornea, which is not derived from the donor and is made from the artificial polymers, and that also is giving good results in these patients. So overall, there is an excellent chance that they will have a visual recovery and they can be integrated back into their normal life. In any chemical burn, including acid burn, the tearing is sufficient to make the surface heal, so you don't need too much of artificial tears in the acute phase. In the chronic phase, yes, they are important for keeping the eye very healthy. If the tear glands have been destroyed, then it may have to be used for a very long time, and including maybe lifetime. If there is a delay in the institution of the treatment, the corneal epithelium or the covering of the eye will not regrow, and that predisposes for the eye to rupture, get infected, and there is a chance that the patient may lose the eye, and once you lose the eye, the hope for regaining the vision may be very difficult. But yes, there is a hope for those kind of patients as well. In future, there is something called sensory substitution, that we can send the visual signal through different other senses. In LVP, we have a big team who contributes to the care of these patients, including starting from our patient care staff to the nurses, and the doctors who specialize in this area include Dr. Sayan Basu, Dr. Bhupesh Bagga, and then our theatre staff, visual rehabilitation team, retina colleagues, plastic surgeon, then the clinical psychologist. So we have a very big team that is specially designed to take care of these patients. The patients I have treated have come from all over the country, from Delhi, Bangalore, Bombay, Ahmedabad, from Indore, all over the country. There is no particular distribution, Calcutta, Dhaka, all over the place that these incidents keep happening. The acid has to be much more strictly regulated, even though there is a law, but still the people can buy acids from shops, which I think has to stop immediately.
30 रुपए की बोतल 50 की, इससे इंसान की ज़िंदगी कितनी बिल्कुल मतलब ही ख़त्म ही हो जाती है। अब आज मैं 9 साल से बैठी हूँ, लेकिन मैं किस लायक हूँ एक बात बताओ, मैं मर भी नहीं सकती, जी भी नहीं सकती। एक बात उम्मीद पे बैठी हूँ, काश ठीक होंगी, नहीं होंगी, लेकिन मेरे 9 साल कौन वापस ला के देगा।
When you get this situation, don't be negative. What happened is happened. Focus on the treatment aspect and get the patient quickly to the doctor, and especially if you can get him to the eye doctor or a cornea specialist, that is better. And then the recovery path can be accelerated, and there is a good chance that the visual recovery can be excellent. And once you are recovered, then deal with why it happened, what can be done. And in general, I think in society, especially in Indian subcontinent, we need to be more tolerant and don't use these chemical weapons to destroy each other. Instead of that, we should talk to each other, sort out the differences, and do not destroy a valuable life on this earth.
जी, कोर्ट में ये कहा है कि 3 लाख रुपए जुर्माना, जो मैंने आपको बताया।
तो जब भी ये फैसला आया था कि अब आगे से मतलब जो कोई भी ये एसिड लेने जाएगा शॉप पे, तो उससे उसकी आईडी ली जाएगी और ये पूछा जाएगा वो किस लिए एसिड खरीद रहा है, ऐसे करके मतलब आगे खुलेआम एसिड नहीं बिकेगा और दुकानों पे मतलब रिकॉर्ड दिया जाएगा। अगर अब किसी के साथ एसिड अटैक होता है तो 15 दिन के बाद 1 लाख रुपए का मुआवजा, उससे इलाज में मतलब हॉस्पिटल में फ्री इलाज मिलेगा और 1 महीने बाद 2 लाख रुपए का मुआवजा। ये था फैसला। कोई सजा या कोई मुझे पैसा भी दे, मेरी वो ज़िंदगी वापस आ जाएगी? क्या मैं पहले जैसी कभी हो सकती हूँ? इतनी सर्जरियाँ हो गई, हर सर्जरी कितना मतलब दर्द, कितनी मैं तड़पती हूँ दर्द में, कितना सहन करना पड़ता है, इसे कोई भी नहीं देखता। अभी ये मेरे को अपना वोटर आईडी कार्ड बनवाने में भी इतनी झंझटें हुई थी, इतनी दिक्कत हुई थी। बोल रहे थे कि ब्लाइंड लोगों का ये नहीं बनेगा। मैंने कहा ब्लाइंड लोगों का ये नहीं बनेगा, क्यों नहीं बनेगा? कह रहे वो वोट कैसे डाल सकते हैं। मैंने कहा ब्लाइंड लोग मतलब खा नहीं सकते? बहुत मतलब भागा दौड़ी करके ऐसे सुनवाई नहीं होती, बहुत दिक्कत होती है मैम।
There is a stigma attached to it that once you get an acid burn, your face get defaced, you don't see well. So people stop living and they stop finding the treatment and possible solutions, which I think is very important, not to give up, keep fighting. And there are a lot of NGOs, and especially those which are started by these acid attack survivors, and they are doing a fantastic job, which will contribute the enhancement of quality of vision of these patients. And society in general need to help and support these NGOs.